Hello, how are you all? Hope you are fine and preparing well for AMC Part 1 examination. This is Dr. Zahra and we are solving some recalls from the Gynae section. So let's start. A 20-year-old woman present to your clinic because she has never had a period so far. On examination, the genitalia appears completely normal. Breasts are immature but pubic and axillary hairs are present. Pelvic ultrasound shows normal uterus and fallopian tube, but ovaries contain a small amount of connective tissue and no follicles. Which one of the following is the most likely cause of our amenorrhea? A. Hypothalamic lesion, B. Mullerian agenesis, C. Turner syndrome, D. Hyperprolactinemia, E. Pituitary lesion. So first of all, what is the case? This is a case of primary amenorrhea because she is 20 years and she has never had a period so far. So this is a case of primary amenorrhea. What is the cutoff age to diagnose the case as primary amenorrhea? Whenever patient not developed her secondary sexual characteristic, so we have to start investigation from 14 years of age. Patient is having a no periods or amenorrhea, or plus patient has not developed secondary sexual characteristics. So primary amenorrhea plus not developed her secondary sexual characteristic. So we have to investigate from 14 years of age. If patient developed her secondary sexual characteristic with primary amenorrhea, so we have to investigate from age 16 years. If patient having a secondary sexual characteristic with amenorrhea, then we have to investigate from 16 years of age. If no secondary sexual characteristic, then we have to start investigation from 14 years of age. Please clear this point. So this is a case of primary amenorrhea. She is 20 years and she has never had a period so far. On examination, the genitalia appears completely normal. This is one of the important statements, that genitalia appears completely normal. Breasts are immature but pubic and axillary hairs are present. So breasts are immature, this means our ovaries are not functioning. What is the relation with the ovaries? Ovaries secretes estrogen, and estrogen play a vital role in the development of the breast. That's mean estrogen is deficient. Breasts are immature, that's mean estrogen are deficient and ovaries are not functioning. And they have already mentioned here, and making the life easy by mentioning this, that ovaries contain a small amount of connective tissue and no follicles. So let's start discussing these options. Is this a hypothalamic lesion? No. What are the statement they will mention with the hypothalamic lesion? So number one cause is Kalman syndrome, in which GnRH neuron of the gonadotropin releasing hormone neuron will be absent. So patient present with the primary amenorrhea or and anosmia with no sense of smell. So these are the feature they will mention with the Kalman syndrome. This is one of the cause of hypothalamic lesion of the, or hypothalamic cause of the primary amenorrhea. Number two, if sometime patient is having a low BMI or anorexia nervosa or patient is a belly dancer, in which the gonadotropin releasing hormones are suppressed, and that's why they are uh, causing the primary amenorrhea. So these are the common cause of the hypothalamic amenorrhea, but here they didn't mention any statement like this. So this is not the cause of primary amenorrhea. Hypothalamic lesion here is not the cause of primary amenorrhea. Next, Mullerian agenesis. So by mentioning this, the genitalia appears completely normal. So what happening in the Mullerian agenesis? Vagina will be atrophied or absent, okay, and as well as uterus will be atrophied. So this is actually the paramesonephric duct and development problem, in which the uterus will not form or atrophied or vagina will be absent. So here they didn't mention anything. This is not the cause of primary amenorrhea, Müllerian agenesis. Now coming to the D option, hyperprolactinemia. With the hyperprolactinemia, they will always give that she is having a galactoria, or they can mention that milk discharge from her breast, milk discharge from her breast with the cause of hyperprolactinemia. So this is not the cause of primary amenorrhea. Now pituitary lesion, this is also not the cause. Why? They will mention with the pituitary lesion. So pituitary, what are the pituitary lesions? With a tumor, pituitary tumor, there are the chances that it cause a suppression of FSH and LH with um, prolactinoma. So prolactinoma is the tumor in which the pituitary cause of amenorrhea will be there, and it suppress the FSH, follicle stimulating hormone, and luteinizing hormone of the pituitary that cause the amenorrhea. So with the tumor, what are the feature will be there? The patient, they will mention they have a patient having a headache or vision disturbances. So that's why this is not the pituitary lesion, because they didn't mention any of the statement. So the correct answer is Turner syndrome, and remember this is one of the common cause. Turner syndrome is one of the common cause of primary amenorrhea. This is the chromosomal cause, and it is 45XO, in which ovaries, this is also called as ovarian agenesis. Ovarian agenesis. So this is the correct statement, Turner syndrome. So let's start reading the explanation. Correct answer is C, Turner syndrome. The clinical features described in this scenario are consistent with the diagnosis of Turner syndrome. This is characterized by the karyotype of 45XO. What are the clinical features? Short stature, webbed neck, puffy hands and feet. Short stature is very important. If this is there in the question, always think about the Turner syndrome. Webbed neck, puffy hands and feet, coarctation of the aorta, cardiac abnormalities, high arch palate, absent secondary sexual characteristics when puberty is expected. So breasts are immature, that means she's having a absent secondary sexual characteristics. So in Turner syndrome, the ovaries consist of a small amount of connective tissue and no or just a few atrophic follicle streaks. Gonads, the external genitalia, vagina, uterus, and fallopian tubes are well developed at birth and anatomically normal. So this is the cause here. I hope this video clear your confusion now. Thank you so much.